Bennet.
Thank you, Mr. Chairman. Thank you for holding the hearing, and thank you both for your willingness to serve. Dr. Shambaugh, I'm concerned that for years across Democratic and Republican administrations, we've neglected to implement a coherent strategy in the Indo-Pacific region, and instead China has expanded its global influence, including across Latin America. For example, businesses in Colorado and throughout the country are experiencing supply chain challenges driven in part by our over-reliance on China. In light of supply chain disruptions due to the COVID crisis and ongoing global instability, how can we use our trade and development policy to reshore critical supply chains in the United States and nearshore others? Can this strategy strengthen our relationship with countries across our hemisphere?
Thank you, Senator. I would say the shortest answer is that yes, policies aimed at reshoring or friendshoring, as I know Secretary Yellen has referred to it, or nearshoring, it presents opportunities to try to strengthen our supply chains. I think some of that we've seen. I think firms are learning on their own that firms that tried to minimize cost and had only one supplier as the lowest cost supplier are suddenly finding that may be the lowest cost in good times, but not in bad times. And so they're trying to diversify their supply chains on their own. But I think it's certainly the kind of thing that a coherent set of policies aimed to work with allies, both across the Indo-Pacific and in the Western Hemisphere, can be important as ways to try to make sure that we have critical supply chains that are durable and lasting even in bad times.
What kind of tools are available to you or the administration, including things like development banks to try to improve the supply chains, here and in Latin America as well?
Certainly when it comes to Western Hemisphere, the multilateral development banks become an important partner for the United States to try to make sure that private industry is developing and has access to capital in the region. That's an important goal. Certainly across the Indo-Pacific, the new framework that the administration has rolled out to try to coordinate better with other countries to make sure, whether it's around rules, whether it's around sourcing, whether it's around data transparency, that as many things as we can do to make sure firms understand a coherent set of rules makes it much easier for them to transact across countries.
Thanks. Dr. Haffajee, during your time as Acting Assistant Secretary for Planning and Evaluation, the office published a report on the effect of the expanded advanced premium tax credit on health insurance coverage. This support has reduced premium costs for over 100,000 Coloradans to enroll in affordable health insurance plans for the first time, but it's set to expire at the end of the year if Congress fails to act. In Colorado, if we fail to extend this support, people with the lowest income could see their premiums increase 2,500% per month. That's 2.5% per month. That's an unacceptable outcome. When tax cuts for the rich are about to expire, Congress has bent over backwards to find funding to extend them. I think we need to do everything we can to extend the premium support. Could you discuss how ending the expanded premium tax credits will affect low and moderate income Americans, and what other kinds of research and evaluation do you intend to focus on should you be confirmed?
Thank you for the question, Senator Bennet. Really here, the HHS and ASPE are committed to expanding access and affordability of coverage to as many Americans as possible. The advanced premium tax credits have been a really important tool from the ACA, but also, as you note, during the pandemic, through the ARP, the increased generosity of those has really made coverage more affordable for more people and covered millions of uninsured that otherwise wouldn't have been covered. You are correct. ASPE has done some analyses to look at what would happen should these go away in 2023. Approximates about 15% of the population on those plans would lose coverage across the country. So this is a really important issue to be thinking about as we move towards the end of this year. ASPE, and were I to be confirmed, would continue to conduct data analysis, support this Congress and this body in understanding what those implications would be.
Thank you both for your testimony. Thank you, Mr. Chairman.